Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. Subscribe at kevinmd.com/podcast. Today, we have a special sponsored episode from NRC Health. We welcome Jennifer Barron, Chief Experience Officer. NRC Health builds a healthcare experience management platform with next-gen AI that drives the most human healthcare experiences for everyone. Today, we'll be discussing strategies for patient-centered and employee-focused care. Find out more at nrchealth.com. That's nrchealth.com. The link will be in the show notes. Jennifer, welcome to the show.
Thank you, Kevin. It's great to be here.
So let's start by sharing a bit about NRC Health.
Yeah, so NRC Health is an organization that has been in healthcare for over 40 years, truly focused on our mission, which is to bring human understanding to healthcare. We work with or have worked with over 10,000 healthcare organizations across the country to improve experiences for patients, the workforce, consumers, and communities. And as you mentioned, we recently launched an AI-enabled platform that will allow us to create a more natural way to collect and analyze feedback and help us better lean together into creating and restoring sacred human connections in healthcare.
All right. So today's conversation is going to focus on strategies for patient-centered and employee-focused care. And we're going to divide this conversation into three broad themes. And the first theme is generational influences and differences in healthcare. So, Jennifer, I want to first ask, how do different generations approach healthcare, and what are the most significant generational differences in expectations of care?
Yeah, so I think as humans, we all approach everything that we do in life from a position of comfort, what we're comfortable with. So when we think about different approaches to healthcare, and we think about that generationally, it's pretty easy to start to see our older generations, our most experienced consumers and patients, typically have a more traditional view of healthcare. Think about what their first experience as young adults were in healthcare, the way that you accessed healthcare. You might actually search for a provider using a phone book, talking to your friends and neighbors, and then actually physically walking to a phone, making a phone call, writing down your appointment, driving to the appointment. Everything was very analog. And that was the traditional model and kind of what we are seeing that older generations are most comfortable with. That's a preferred approach, is that traditional model. We also have folks that are more in sort of an adaptable space. So Gen X is a great example of that. I'm actually a part of Gen X. It was the start of the internet. So although there weren't a lot of online experiences, it was still the traditional model. Gen X was really the first healthcare consumer in that we were the first generation to have access to doing broader research and getting more information through the internet. When we look at millennials were the first kind of digital natives, the first generation to grow up with more technology. When we see as young adults, millennials became healthcare consumers, we started to see 9-10 years ago an uptick in online scheduling and more of a shift to digital tools in order to meet the needs of that generation whose primary, focus was digital. Now we're moving into Gen Z becoming healthcare consumers for themselves, young adults, as they are entering this world. They have never lived in a world without a digital first experience, right? Everything is at their fingertips, very easy, and they have all of the information that they need very quickly at their fingertips. So, that is sort of how we see preferences in healthcare evolving and across generations. And it creates right now, at this point of time in our history, a complex environment for us in healthcare to navigate because we have to meet the needs of all of those different approaches and preferences.
And I certainly see exactly what you're saying. I'm a primary care internal medicine physician. And normally, when I see a new patient, the first thing I ask is, how did they find me? And those generational differences certainly come into play because some of the older patients, they find me through word of mouth, right? Through friends and family. But you talk about some of the younger patients and they say, oh, I found you by Googling you. And I
Yeah,
found you just from doing some of these social media podcasts. So what you're saying, definitely, I'm seeing that firsthand.
yeah, absolutely.
So do you find that there are certain aspects of healthcare that are valued by older generations, and how do you think they contrast to those of younger generations?
Yeah, so we actually recently did a meta-analysis of patient feedback. We looked at over 5 million patient feedback surveys that we received between November of last year and October of this year. And we saw, first of all, I think it's interesting, a shared value across all generations being involved in their care. Every single generation, through that qualitative analysis of comments on these surveys, that's shown through loud and clear. They want to be involved, they want to have input in decision making. Now, that might look different from generation to generation or individual to individual, right? The level of involvement, but they all want to be involved. What we saw from our older generations, Gen X through silent generation, was also a strong leaning into a value of focus and paying attention. So they want a provider that when they are there, they're fully present, probably maybe less willing to be okay with multitasking. And when we think about the EMR
Mhm.
and that screen sort of creating a barrier, we can see that the older generations are less tolerant of that. They want full focus. And also, no big surprise, probably because they do consume more healthcare, a greater value on a provider being prepared with medical history when they meet with them, which also is consistent with that personal attention. What we saw from younger generations in that analysis was a high placement of value on what I would say are more relational attributes. So a provider that is approachable, a provider that maybe brings humor into the conversation,
Mhm.
is a real person, has shared interests with them. And a high value on courtesy and respect. So kindness and humility and honesty also kind of came through in those themes. So I think that also shows a little bit of the evolution that has occurred from, older generations that again started consuming healthcare in a more traditional model where, the provider was kind of the voice that was listened to, and that's what patients did, whatever the provider kind of suggested, that's what they did primarily, to younger generations who are really looking for more of a partner in their care. And they do have a more of a focus on wellness, our younger generations. And so really looking for that partnership from a provider and a health system.
And when you said earlier that a lot of these patients wanted more of a input in terms of their care, more of a shared decision-making approach. So what exactly would that look like according to your surveys?
Yeah, this is where individualism, I think, comes into play, and personalization, and how organizations and providers can start to think differently about how do we actually collect feedback from all of our patients to understand how they want to be involved in decision making. We don't see a broad theme on that how, we just know that it is something that comes through in these analyses as being important, but that can be a very personalized thing. There might be patients that you have, for example, in your practice who would define that as, I just want everything to be explained to me
Mhm.
and to have a good understanding and to be able to keep that communication open. Whereas you may have another patient, regardless of age, who wants to have a dialogue, who has done their own research, who wants to be able to bring that research into the conversation and get your opinion and advice on that and come to a common treatment plan.
You mentioned earlier that Gen Z patients are the first generation that are digital natives. How has that digital transformation in that generation impacted patient care?
Yeah, so I think it has driven a lot of our digital front door work that we've done. And so, that is really catering primarily to the younger generations, both millennials and Gen Z. But when we look at younger millennials and Gen Z, I actually don't think that evolution is complete. It's
Mhm.
going to continue, and those generations will continue to challenge us to think of new ways to deliver healthcare and healthcare experiences. But I mentioned online scheduling, before that was that was an improvement in experience that was made really specifically in modern times for that digital age and that digital culture. As we are moving into more of an AI centric culture, we are starting to see applications, and that this is, again, probably a whole nother show, but I'm sure you've had lots of conversations about this, but even ambient AI,
Mhm.
which is now being implemented in a lot of practices, is really designed, again, think of the values that we talked about in relationship building, being more relational with patients, being more fully present. Ambient AI is an application of that is very comfortable to younger generations because their whole lives have been lived digitally and they're very comfortable in that space. And so it does allow for that relationship building to occur in new ways. It kind of lifts that screen from the room.
Now, with that context, where different generations may have differing expectations of what ideal healthcare should be, how can healthcare systems adapt to meet some of these dueling goals that different generations have during an office visit?
Yeah, so dueling goals, I like that. That's the first time I've heard that. And I think that's a great term for what everyone is feeling, because the reality is we have to live in this world of ensuring great experiences that are both analog and digital and allowing people to choose their preference, right? So I think what we can do as organizations is figure out, how do we understand the journeys that all people are taking? So
Mhm.
if you think about, for example, a person who is accessing care at a clinic, maybe it's a primary care practice. So from the arrival to the discharge and leaving the space, what does that journey look like? And where do you have an opportunity to offer digital tools that will meet some of the preferences of our primary patients while still allowing for an analog channel for our other generations that maybe aren't interested in using those tools? We have, I was just talking to one of our partners in the last couple of weeks who has implemented an e-check-in.
Mhm.
So it's, you drive up, it's on the app, you say, I'm here. It takes care of all of your check-in process. You don't even have to go to the desk. They know you're there. Whereas that's great for younger generations. Some older generations might not like it. Some people in older generations might like it and use it. But having those tools and ways to kind of shift in and out of analog and digital right now is what we really have to design for across those journeys.
You're listening to a special sponsored episode from NRC Health discussing strategies for patient centered and employee focused care. Find out more at nrchealth.com. That's nrchealth.com. And the link will be in the show notes. The second theme, Jennifer, I want to talk about is the patient employee experience, gaps, challenge, and trust. So, how can healthcare organizations become more intentional about both the patient experience and the employee experience?
Mhm. So I think, first of all, it's a decision that has to be made, and an understanding that we are in the age of experience. We live in an experience economy. There's a great book with that title. But I think more and more with younger generations, we do see this primacy being given to the life experiences that we're having,
Yeah.
and people really leaning into that. Healthcare has been a little slow to make the decision that we really have to understand how to intentionally design meaningful experiences for both our workforce and our employees. As humans, we are all having experiences all day long. That's what life is. It's a series of experiences that are either good or bad, meaningful or not meaningful. And I think in healthcare, historically, we have often left experience up to chance. We have designed our processes around what we need in order to deliver care without being as intentional as we could be about really understanding the actions and the touch points that we are requiring people on both sides of the stethoscope to take on a daily basis. So I'll go back to understanding the journeys. I think health organizations can start with a problem, and instead of fixing that one little problem, look at that problem as part of a holistic journey. Understand how it fits in with the journey and fix that problem as part of that whole journey. Because sometimes we fix a problem in a silo and then we create other problems for other parts of the journey, unbeknownst to us, because we aren't looking at it in that way.
So, what are some of the barriers that healthcare organizations face when talking about and meeting both the patient experience and the employee experience?
Well, I think one barrier is leadership development. We don't necessarily always include this way of thinking, sort of a human-centered design way of thinking in our leadership development programs. And it is a true leadership capability as we're living in this current world and we move forward in the future. So it is a leader's responsibility ultimately to understand the experiences of both the people their teams are serving and the teams themselves. And that is a skill. It isn't something that's natural to everyone. And we often end up promoting great individual contributors who have done a great job in that space. We put them in a leadership role and we don't teach them that skill of really understanding those experiences and how to design meaningful experiences in a human-centered way. So I think that is one barrier. We haven't really moved into this human-centered design phase in healthcare as holistically as we should. The other barrier that we have been talking about in this industry for as long as I've been in it, which has been over 30 years, are silos. We, still haven't effectively managed to break down those silos. And again, if we put the right processes in place, if we look through a human-centered design lens, and we look at our improvement opportunities as part of journeys, then that naturally helps us break down silos because we start to see the connections between departments and functions. And if you bring the right people around the table, you include the voice of the patients and the workforce, you come up with solutions that are designed for optimal experiences. It's what happens in other industries, and we've just been a little behind getting there.
No, I agree with that when it comes to silos, because that's the way, from a physician standpoint, we've been trained in silos. It's very uncommon that we talk to other departments, other healthcare disciplines, other specialties, even. So breaking down those silos and realizing that that patient has that common holistic experience, I think, is important. What would be an
Yeah.
example of that? What would that look like in a successful case study?
So I think if you're thinking, for example, about, and this I'll just pick an easy one, is something that I have focused on in my career is, the arrival experience, and particularly maybe an arrival experience at a hospital, which can be, quite intimidating. If you really look at the arrival experience as a journey from the time someone pulls onto campus or, onto the organization's property to parking, walking into the facility, how do you check in, and then how do you get to where you need to go? There are many people often involved in that, multiple teams, parking and transportation services, groundskeeping, operations, if there's a guest relations team or not, those folks being involved. And instead of looking at each of those functions in their own individual silos, and you put the patient in the middle of that and say, how do we create a better arrival experience for everyone who comes here? You bring all of those people around the table and you start to look at that entire journey, and you see things that maybe you didn't see before. And you see a lot of those transition spaces. This also works for employees in our workforce, because every single person who's coming into our facilities every day is also having an arrival experience as they get to work. So what does that look like? How far do they have to walk from where they've parked to get to where they're needing to go? And guess what? We have found, or I have found in my experience, that paying attention even to that one thing creates a better experience as patients and providers come together throughout the course of the day, because it alleviates some of that stress that may occur if that arrival experience isn't great. So that's one example.
I talked to a lot of guests on the show about the employee experience, about the experience that various sectors of the healthcare workforce are going through. And sometimes, of course, if they have a poor experience, that's going to affect the patient experience as well. After COVID, there has been a shortage, of course, of healthcare workers. There's been an increase in burnout of physicians and nurses. So, in that context, how can we maintain the patient experience when sometimes the employee experience is really suffering from a burnout standpoint?
Yeah. So I think actually one of the things that I saw, and again, I was actually working in a health system during COVID. And so I had that lived experience, going in every day and seeing what was happening during COVID. COVID weirdly catalyzed a right sizing of the focus on our care teams. So, it wasn't over indexing into patient experience. It was a recognition that we have to equally care for our workforce as well. And so I think that is still a challenge. And as you said, we've had a loss of our workforce post COVID that we're still trying to recover from. But as we lean into our workforce, again, we have to understand the daily experiences that people are having. That's why it's really, truly a leadership capability at this point in time, because leaders have to be able to understand how to have those conversations with folks on their team, how to understand their points of view, where people are coming from. If they are feeling burnout, if they're starting to have signals of burnout, understand what's contributing to that. And then again, prioritize really resolving those challenges so that we can bring joy and meaning back to our workforce, which again, a lot of data has shown that then that translates to great experiences to the people that we care for.
So I'm hearing that, of course, healthcare leadership really needs to take that prominent role in improving both the employee and patient experience. Well, what would that look like in a practical case?
Yeah, so I think a lot of it starts with listening and sort of leaning into curiosity and listening. We have gotten so busy. We have so many competing priorities, and the problems that we are working to solve in healthcare are very complex. And leaders often get sort of buried in all of that, right? There's so much to do. So at the organization level, really intentionally thinking about upskilling listening and how do we capture ideas from our care teams that are on the front lines, that are actively caring for our patients and, through the course of their day, delivering something to the front line. We don't do enough to listen and capture great ideas from those employees. So a good case study that I have seen is, programs that allow healthcare providers and workforce to elevate ideas to solve everyday problems that they're seeing, and to actually create a system where that feedback, those ideas get to the right level of leadership, are evaluated, can be funded, and then implemented. I think all of us as employees, we spend so much time at work. And when we see problems and we feel disempowered and not able to see the right channel to help elevate ideas or solve the problems, it's extremely frustrating. And again, can lead to feelings of overwhelm or burnout. So even just starting there with reevaluating how we're listening to our workforce and cultivating ideas and implementing those ideas, I think can go a long way.
So I think that's going to lead into our third theme. And I want to ask more about listening. Our third theme will be actionable steps and reimagining healthcare practices. Before getting to the third theme, I want to remind our listeners that we are listening to a special sponsored episode from NRC Health discussing strategies for patient centered and employee focused care. Find out more at nrchealth.com. That's nrchealth.com. And the link will be in the show notes. So, Jennifer, I want to focus up on what you said by upskilling listening and how important that is. So, what exactly would that look like, say, from a clinician standpoint? How can we better listen to patients? Focus groups? Would it be surveys? What I do in the exam room? What are some ways that that would look like from my standpoint as a physician?
Yeah, I think it's all of that. So I would say let's, again, go back to the organization level. At the organization level, there are lots of different ways to listen. And many organizations sort of have the annual engagement survey where feedback is collected. What we've seen in our data is that that is often not enough. That employees report, I think only 65% of employees say that they don't believe their feedback actually matters,
Hmm.
right? So that's a pretty high number if you're giving feedback and you don't think that it matters. So really thinking through, how do we listen daily? How do we listen weekly? How do we listen monthly, quarterly, and annually? And there are different tools that can be used for all those listenings, going from rounding to that annual survey and lots of things in between, and pulse surveys that could be done, topically on a regular basis. So again, that's at the organizational level. How do we listen, really harness ideas that can be implemented, and then take action on those? At the frontline level and at the provider level, I think, we have had such a long conversation around improving communication and that we need to improve communication. First and foremost, I think from a provider level, embracing it as a skill. As a clinician, you've had to learn a lot of skills, scientific skills, skills for diagnosing, relationship skills. One of those relationship skills is effective listening. And so looking for different opportunities to improve that. There are, we provide videos, video tutorials for folks. Lots of organizations have experienced coaches that will actually shadow a provider and give tips in real time on how to improve communication. Not being afraid of patient feedback. And I think that is a human challenge for a lot of providers. I mean, I love to hear your thoughts on that. I have talked to other providers. It can be hard to receive feedback sometimes that maybe is hard to digest. But if we can approach that feedback through the lens of learning and as an opportunity to build a new skill or to up level a skill that we've already been working on, we can start to consume that feedback in a more positive way and not take it so personally, but really, again, take it as I need to continue to improve on this skill.
So, as you could imagine, there is a spectrum in terms of how that clinician feedback is presented, right? I've heard health systems publicly post that feedback almost like a wall of shame, almost, where they will be kind of on a competitive level competing with other clinicians. Certainly, I get feedback from these surveys confidentially through email. So there's a wide spectrum. Just from your experience, what are some of the more constructive ways that feedback can be presented to the medical staff?
Yeah. So I think the wall of shame, I believe at one time it was real. There has been a lot of work done to move away from that and create a more positive conversation, obviously. One of the things that I have seen be pretty effective, it was actually a program that we launched when I was at my prior health system. We created a recognition program for providers that had high scores in patient feedback around the communication domain. And so it was very fun, very positive. It was a quarterly recognition. We would have an event around it, celebrate those providers, publish their names so everyone could see, who kind of won the awards. And we started to see more and more providers upskill. And each quarter, the number of physicians recognized actually improved and grew quarter over quarter. It was pretty consistent. What was also effective about that program was for physicians that perhaps were working to build that skill, they knew who their peers were who received great patient feedback. So you would know who you could ask. Hey, what do you do in this? I'm struggling with this. What's your skill? How do you approach that listening? Or maybe even finding a provider to talk to about a specific patient that's been challenging from a communication standpoint to get their feedback on how they might approach something differently. So created a community, more of a community conversation around that communication domain and how to upskill our communication with patients, and allowed us to leverage people who may be more naturally skilled in that space to be able to mentor others.
Now, looking through all that data of patient feedback, what would you say are some common themes that are present in that patient feedback? And what are some of the highest yielding things that clinicians can do to improve some of that feedback based on the survey data that you have?
Yeah, so I think again we sort of talked earlier about what we have seen in the qualitative feedback that we did on our comments. We know communication theme has been a priority theme for a long time, and it's not just, by the way, on our physician surveys, it's across all of our domains, all roles. Communication is a primary value of patients in healthcare. And so we've talked a lot about how to improve communication already. I don't know that I have anything specific to add to that, but that actually would go a very long way to improve overall experiences for patients if we just really did a deep dive on learning communication as a skill.
I talk to some patients and say, you may get a survey, and if you have any constructive feedback, feel free to fill out that survey and let us know what you think. Some patients come back and say that they're getting survey fatigue because they're just getting asked by pretty much every facet of the healthcare system to write a survey. Is that something that is a phenomenon? Is that a real thing, survey fatigue among the patients?
So it can be, and a lot of health systems have put survey rules into place to ensure that a patient isn't over-surveyed. So it could be, a patient will only receive one survey in a month, and it would be maybe their first visit, which would be primary care, perhaps. Or if there's a primary care and a specialist, maybe they would receive them for both of it, but not for the lab and not for radiology. I think the challenge is healthcare organizations are so hungry for actionable insights, and we want to get the insights in every little area that sometimes we can burden our patients with that, or it feels like a burden. So that is an art. We have to be careful with that. One of the feedback tools that we just rolled out as part of our AI-enabled platform is a point of service opportunity for people to provide feedback. So it's not necessarily sent to them, but it's QR code based. So if a patient wants to provide feedback about a particular experience that they're having, maybe it's in a waiting room, or it's in a cafeteria, or even the restrooms, then they can scan that QR code and provide it in a more on-demand level. We are seeing holistically, when I talk about, learning to listen more broadly, we can see a decline in response rates from each generation, going back to that generational conversation where we see our silent generation and boomers they have about a 36% response rate to our historic surveys that we send out. Gen X drops to around 24, millennials drop to 12, and Gen Z dropped to a 9% response rate. So we have to start looking at other ways to collect feedback and understand how people are feeling about the experiences that they're having. And that's something that we're dedicated to really bringing to our clients that we work with.
One of the things that you mentioned earlier in our conversation was that healthcare is behind other service industries when it comes to collecting and implementing improvements in terms of the patient experiences. So, with that in mind, what can healthcare learn from other sectors like hospitality, retail, and at-home care to improve patient and employee experiences?
So, I think when we think of other industries, hospitality is a great one. Retail's great as well. The core capability that they have is really that focus on their customer. And so I think healthcare has taken longer to recognize or accept that healthcare is a service industry. It is, I would argue, I've been in it again decades, the most important service industry. It is the most human-centric industry, but we are providing expertise and a service that people are seeking. And that's kind of what a customer is, right? You seek goods or service, you search to find it, you then have an experience with that good or service. And so if you kind of broaden out and look at it from that cycle, we go through the same cycle in healthcare. Other industries, again, have been investing in learning about the experiences they're providing. They've been investing in figuring out how do we mature the way we manage these experiences intentionally across our customer journey. And again, that's sort of a new way of thinking in healthcare. We just started to think that way over the last several years. So I think that's the big learning, is really understanding how those industries put their customers at the core, what tools they use, how they build cultures around it, how they create centricity around the experiences of their workforce and their customers, and then, how they use human-centered design to bring it all together.
A reminder to my listeners that you're listening to a special sponsored episode from NRC Health discussing strategies for patient-centered and employee-focused care. Find out more at nrchealth.com. That's nrchealth.com, and that link will be in the show notes. Jennifer, let's end with some of your take-home messages that you want to leave with the Kevin MD audience.
Sure. I think number one is this whole environment of experience, again, we know is expanding in healthcare. I think we have to lean in with curiosity and through a lens of learning. So I think that can really shift our mindsets as we move forward. And again, really thinking about healthcare experiences as an entire connected journey and not a siloed transaction is going to be really important as we move forward. Leveling up listening, really, that is phase one. If we could do one thing, it would be level up the way we listen to receive actionable insights so we can make improvements that are meaningful. That's the big takeaway.
Jennifer, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you.